Get ready for a harsh flu season. That is the warning from doctors as we head into the winter months. Right now, countries like Australia and Japan are grappling with severe flu seasons that are fueled by a mutating variant. Japan has already declared it an epidemic. We often look to Australia as a precursor to what we might experience here. And based on that, Canadian health experts are concerned for what our country could experience in the months ahead. So we've reached out to Dr. Fahad Razak. He's an internal medicine specialist at St. Michael's Hospital in Toronto. Good morning.
Good morning.
Why is this year's flu season shaping up to be so challenging in Canada?
It hasn't started yet. I think the worry is that we're going to have a very tough season. So typically we see the season start probably in the next month or so. And we look to the Southern Hemisphere, we look to countries like Australia to get a sense of what to expect. Remember, their winter is our summer, so they tend to lead us in the flu season. And they unfortunately have had the worst flu season on record. So that does make us worried. There's also the other factor of the kind of flu strain that comes through. It changes every year. This year, there seems to be a rise of a kind that's called H3N2. And when we look back on previous years, we see that the years where H3N2 dominates tends to be more severe, especially for the elderly. So we have a few factors that are making us worried. We're also, of course, living in a time where vaccination rates are low. So the public is less protected than we hope, and the strain itself looks to be more severe this year.
What is so concerning about this strain, Doctor?
It seems to be a strain specifically that ends up getting more older people sick, especially. It does, of course, affect the young. And remember, this is a vaccine for everybody, everyone over the age of 6 months. But when older people get sick with it, they tend to end up in hospital at higher rates, more severe disease, more deaths. And so the worry here is that you have a high volume of very sick people coming into a system that's very constrained. And those who are most likely to need protection, we're seeing rates are just not where we need to be. The last few years, especially since the pandemic, the rates have been low.
The flu shot, you were available to get it come September, but because of this evolving flu strain of H3N2, as you mentioned, there was this messaging that the vaccine might not be as effective, leading people to wonder, well, should I even get my flu shot? How do you explain that?
Yeah, great question. Yeah, so I want to emphasize that getting the flu shot, along with, remember, we have 3 major viruses every winter. There's flu, there's RSV, and there's COVID. There's historically not been protection against all 3. We have now vaccines for all 3. Getting the vaccine is the best thing that you can do as an individual. The reason why is we really won't know which strain dominates until the season actually occurs. The match could be very good, but even if it's lower, it's still going to give you some level of protection. And remember, the goal here is really preventing severe illness, allowing people to get on with their day-to-day lives, not miss work, not miss school. We want this virus to be as minimally disruptive to the individual as possible. As a physician, I have to say, every year we see people coming to hospital who are critically ill, sometimes on ventilators, sometimes dying. And this is preventable in terms of the disease itself, or at least there's an opportunity to reduce the severity. So yes, the match may not be as good this year. We don't know, but I want to emphasize that the value of the vaccine remains high.
Vaccine uptake, as you have mentioned, is really struggling in this country. You know, we saw last week the lack of people getting vaccines leading to the loss of the measles eradication status. Data shows that fewer Canadians are going out to get the flu shot. These figures from 7 provinces in 1 territory show about just 1 to 4% less Canadians receive the flu shot than in 2025. In Ontario, they had their worst flu season in 10 years last season. So what can be done to reverse the trend? What do you need people to understand about the flu vaccine in order to increase those numbers?
Yeah, look, I was on the front lines when those cases rolled in last year. I'm going to be working this year again. It is very consequential for the system. Remember that our hospitals are not just about flu care. They care for everything. They care for the car accidents. They care for severe cancer complications. When we have this volume of additional patients coming in during the respiratory virus season, it places enormous stress on the system. So for an individual, whatever you can do to protect yourself, for all of us together, reducing the rates of severe illness like flu, RSV, COVID, you're helping to ensure the system continues to work for all of us, for all medical care, not just for infections. I think the most important thing we have to get back to, and what we've sort of lost the thread on, is that these vaccines are a very low burden. You go in, you get your shots once per year. And then that's it. It's this base layer of protection. It's like wearing your seatbelt. It's something you just do and you move on with your day. And I think we've gotten to a point where there's this enormous contentious conversation about vaccines, and we've lost the fact that it's just that low level ongoing protection. And what's fascinating about these infectious diseases like flu, for example, is it's not just the infection when you end up in hospital. For example, we see rates of heart attacks and stroke go up by almost 5-fold over the next 30 days after an infection. Again, things like vaccines help reduce that.
Dr. Razak, internal medicine specialist at St. Michael's Hospital in Toronto. Great conversation this morning. Thank you.
Great to see you. Thanks.
If you like that video, make sure to subscribe to the Your Morning YouTube feed, where you can find all kinds of new content posted every weekday morning.